Hi guys, I'm Ethan. I'm going over diabetes insipidus today. So what is diabetes insipidus? It's the inhibition of ADH or antidiuretic hormone, also known as vasopressin. So vasopressin and ADH are released by the hypothalamus and the pituitary gland, and it results in kidney malfunction. So with the kidney malfunction, we see a fluid or electrolyte imbalance caused by excessive urination. And then it's not related to diabetes mellitus. It's often mistaken for each other. However, mellitus deals with glycolysis and glucose, whereas insipidus deals with strictly that fluid electrolyte imbalance. Diabetes insipidus is very rare, with only 200,000 cases a year or less. So there's three types of diabetes insipidus. One type is the central diabetes insipidus, dealing with damage to both the pituitary and hypothalamus. The second type is nephrogenic. That's a defect in the kidney tubules. We often see that with renal failure patients. And the third type is gestational. It's seen during pregnancy, starting during ovulation and ending around postpartum. It's due to a placenta defect. Causes of diabetes insipidus, as stated by Johns Hopkins, includes malfunctioning hypothalamus, damage to the hypothalamus or pituitary gland, brain injury, tumors, tuberculosis, a blockage in arteries in the brain, encephalitis, meningitis, and sarcoidosis. Sarcoidosis is an inflammation of the lymph nodes and other tissues surrounding the system. So with diabetes insipidus, we often see many characteristic symptoms such as extreme thirst that can't be quenched through normal bimouth fluids. So we see these patients drinking liters upon liters of water, usually without any positive effect. We also see large amounts of urine production, and because of that, we see polyuria, nocturia, and a lot of weight loss. Because of the nocturia, it also leads into insomnia and depression, usually. So diagnostic testing for diabetes insipidus, it includes urinalysis, blood tests, and water deprivation test. A water deprivation test strictly looks at dehydration risks and skin turgor throughout the body. So treatments for diabetes insipidus includes fluid increase intake. So we're going to look at those bimouth fluids again. This is strictly for those mild to moderate cases. Other cases, such as severe cases, we'll see medications prescribed, such as desmopressin or chloramapridine. These medications help the kidneys process fluids easier and at a better rate. And then we also see genetic testing as well, because part of diabetes insipidus, their primary purpose is, or the primary cause is genetics. Secondary causes include your CHF or congestive heart failure patients or excessive diuretic use. So you can find all of that on Mayo Clinic, as well as other diagnostic tests. So complications of diabetes insipidus include dry mouth, skin elasticity, thirst, and fatigue. And then we also see that electrolyte imbalance, which leads to other organ problems, such as the heart, liver, lungs, etc. These patients are usually very sick. They usually have multiple issues going on with other body systems as a result.